So I'm going to ask you guys to just, while we have the Q&A, are there questions for our panelists? So I'm going to invite all the panelists up, and if we can have Rachel and Ali, where are you? I'm not seeing you.
I think Ali had to step away, so it's just me.
Okay. And then Rhiannon, if you want to turn on your camera too. Okay, and we do have a mic here if there are questions. There's got to be questions. Come on. Oh, go ahead, Sabrina.
Oh, wow. Somebody thought somebody was talking. Okay. So I heard, I acknowledge and heard about challenges of conducting research during the pandemic, and but I also heard reference to openness of participants, and so it might be kind of a funny question, but I wondered whether there were any advantages to conducting research in this context with just with that in mind.
Can you just build out on that question a little bit?
Sure. I guess something I experienced early in the pandemic is this greater vulnerability and openness that people were showing in, regular meetings, and I wondered whether that carried into your experience with research, if you found that participants maybe were more willing to share than in a previous context. If the answer is no, this is going to be a very short Q&A.
I can speak. I'm not in the Yukon. I'm based in southern BC, and so the one thing that COVID has definitely allowed us to do is that option of virtual. So we were able to, Brenda and I would go into the community, we would have engagements, but then we could go back and follow up with virtual meetings for individual stakeholders, particularly for those in the service providers. It could be very difficult to sit them down while in community for like an hour-long interview. That just wasn't possible. But we could connect with them for 20 minutes, half an hour at a time that was really convenient for them. So they weren't constrained to the time that we were hosting the engagement session. So I found that that was definitely a huge benefit. And then in general, I would say people were so open and wanting to talk. I don't know if that was a COVID related thing or if it was because we're talking about youth mental health.
For us within Yukon First Nations COVID response, we were entirely virtual the entire time, and our project has the interviews that were conducted using Zoom with leadership and staff, as well as the caucus call and minutes from Yukon government meetings. We also had the Yukon First Nations COVID response working group, which met by Zoom weekly and then moved to bi-weekly. We had 120 meetings during the pandemic, and it forged incredible relationships across Yukon First Nations colleagues working in COVID response and communications that otherwise wouldn't have been meeting weekly. And so you built a real community, and that led to tremendous information exchange amongst Yukon First Nations that was really invaluable in response, as well as informing this report as well. Our work, we would listen to the advocacy of leadership and then move towards implementation at the working group.
Sure. Rachel, did you have anything you wanted to add?
I would say that it was harder. I would say that we had the exact opposite experience, that virtually just wasn't going to happen for us. And so being there in community was the only way to really get the interviews and research done, that all of our interactions with council and planning and focusing the project was done remotely, and that was a very sort of long process that happened over about a year and a bit, but then once we were kind of on the ground in community, everything came together very quickly. So I've never really encountered tons and tons of resistance to research. If you're asking the right questions, people are always willing to answer them. And so, we were met with a lot of willingness and openness to do the work that, but for me, that's been consistent over my career over the past 25 years conducting research in community. So, but I have to say that it is a little bit hard to, yeah, you do feel a little bit bad asking people to be interviewed who about their burnout when they're really burnt out. So it's a little bit, like not, being very conscious of, the burden that you're putting on people to spend that time talking to you was very, very present in a way that probably isn't always as present in other contexts.
Thank you. I see Michelle.
Thanks, Mithia. Hi, everyone. My name is Michelle Leach. I am an immigrant to Canada, and I've been living on this territory for 7 years. I'm the scientific director for Yukon Strategy for Patient-Oriented Research, hosted at Yukon University. I have a question that's focused mostly for the first talk. I'm riding on the coattails of just having been to a conference on mental health in Vancouver. And there was this really incredible presentation that was done in collaboration between an emergency doctor, physician who works at BC Children's, and a psychiatrist who works at BC Children's. And they had collated 10 years of data that looked at mental health crises presenting in BC Children's emergency department, and how the rates of crises since 2002 have just continued to raise up in an upwards trend over the last 10 years. And one of the striking pieces of evidence that they presented, which has also been shown globally, is that youth that are presenting either as having attempted suicide or successfully committed suicide is really in correlation with school. They find that those numbers significantly decrease when school is out for term or on weekends, and that it's not showing as something that's more apparent in winter versus summer, as they've seen this in Japan, Australia, etc. And so my question is, when you're engaging with youth, one of the themes that we've actually heard is that when schools shut down through the pandemic, that it negatively impacted youth. But the data that they presented was in fact the opposite. When schools reopened, they had this significant jump in these suicide attempts and presentations to BC Children's Hospital as a consequence, what they believe correlates as a consequence to the school reopening. And so I'm wondering if you heard anything as you were engaging with youth. And I don't know, Rachel, if there was any engagement that was done with youth. No. But if that came up as one of the themes, was how the school closures and or school reopening impacted their mental health.
So I'll maybe just preface that with, I think that's a really great example of urban data versus rural realities. And when we take a look at these large sets of urban data, how can we apply a place-based lens to that data? And so with that, a place-based lens in Watson Lake. What happened to school closures in Watson Lake?
Well, I was going to say for Watson Lake, just given where we are, there is a lack of services. And I think that's where this comes from. School is a very social event for a lot of people, and being isolated in your home with current situations that may have been occurring, it just was amplified. So for people coming back to school, it was a better situation for them.
And the school closures just didn't really happen in the same way. It was not rolled out. Brenda, do you have those timelines on the top of your head? Brenda also did a lot of timeline COVID research, so she tends to be able to pull it out, and I'm trying to give her some space to pull that out, and I'm putting her on the spot. Do you remember? They didn't have the same, so I can't draw any kind of, for us, I wouldn't say that was a correlation. There is definitely a correlation between relationships and impact at school and youth mental health, including suicide. And I would say we worked closely with the Watson Lake High School, and they have an incredible principal, they have an incredible counselor, but again, you're relying on individuals to be pushing these relationships in this peer-to-peer support program. But that was something just to amplify what you said, Catherine, that the youth wanted things to do, so they were happy to be at school, to be playing on the school teams and whatnot. Mm-hmm.
Thank you. So we have time for one more question. If you can introduce yourself, and then as you answer this question, I would like for the panelists to just close out the comments with a quick round table of if there was one single message that you'd want the audience to take with them based on your research, what would it be? And that has to be like 20 seconds. So go ahead with your question. Introduce yourself.
Hi, my name is Roxanne. I'm with CBC News. Great panels overall. I had a question for the final panel for interjurisdictional dynamics. I was wondering what kind of policy prescriptions that could be drawn from this report for at least, let's say, the territorial government.
Honor the agreements. And the nations that are unsigned as well, and their right to self-determination. I think when it comes to civil emergency response, so that's more broadly, we have to recognize the right for First Nations to build their own legislation and respond to emergencies in the way that they want to and see fit. And we have to build the appropriate collaborative tables for that to happen, and that those tables need to pre-exist the next emergency, because it's in building those relationships ahead of time that we'll be able to build the strength for our next emergency, which will come and will come many times over, not just within pandemics, but wildland fires and flooding and all those sorts of things. Alison, do you have anything else to add on policy?
I think there's some good work that was done by the legal team on the legal policy brief on SEMA. And so thinking about the role that SEMA can play, as well as the Public Health and Safety Act, and looking at the review of both of those together, and when should the Public Health and Safety Act take over, and how do we not have to use SEMA potentially in a public health emergency? I also ran out of time, so I really wanted to thank the CYFN team, including Shadell, Christine, and Alexis for their support.
Thank you. Do you note that the report, the interjurisdictional report, is at the back, on the back table, and the legal brief that Alison referred to is on page 35. Do you guys want to do a quick run through of one single takeaway? One single takeaway.
Probably the lack of capacity and the need to increase it in the communities. It's glaring when you live out in the communities that everything is centered in Whitehorse, and there's not a lot of supports for us there.
Mm-hmm.
I heard the need for consultation from the government for the YG to consult with local communities, to listen to rural communities, to listen to First Nations communities, because they know what's best and they know what's on the ground. And you could see that in some of the rollout of communications to small communities. But yes, please consult.
Thank you. I'm going to turn it to Rachel. You're in the middle of the screen.
Okay. I'll just quickly say that I think the one takeaway for me is that, I think in all of these areas in terms of the research, but also, the topic is that we need to be strengths-based in our approach. And when I say strengths-based, I mean that, the people that we are working with, the nations that we're working with, have the knowledge and the experience to identify what's working and what's not, and that they're the best people to talk to about the solutions as well. So that is what I will say. Masicho, thank you very much for this morning.
Alison or Carrie, go ahead.
I think the one key thing is to trust in communities. That's where innovation happens. That's, you know, whether it's rapid testing or food programs or whatever it is, and we've got to figure out how to build that vessel for what's happening at the ground, what's happening in the ground roots to directly implement or affect the policy that's happening within Yukon government. Because if it's being all born in Whitehorse, it's not going to have the same impact in community.
Administration. Allison, did you want to add anything? No. Awesome. Thank you guys. Please give them a warm round of applause.